Hello, I'm Jim Norton. I'm the director of our UK Center for Interprofessional Health Education. The purpose of this video is to give you an overview or an orientation to the iCats experience in an efficient kind of way. And in the video, you'll be hearing and seeing students, faculty members, and administrators talk about a number of important aspects of the iCats experience. There are 6 iCats sessions beginning at the end of October, toward the end of October, and ending in early February. The sessions are about an hour and a half in duration. You've been assigned to a group of 10 students representing various health professions, and that group is facilitated by a faculty member. Most of the work of the course occurs in these small group meetings with your facilitators and your peers. For each of those sessions, there is some pre-work available to you on Canvas. It's very modest, takes a half an hour, usually less. But I think you'll find that if you take a look at that pre-work before you come to class, you'll get a lot more out of it. So, what are the objectives of iCats? What do we hope that you will get out of this? Well, first, we want you to learn about the academic programs of all of the health professions so that you know the kind of academic experiences your peers are having as you're developing your health career program. Second, we want you to be aware of the scope of practice of all of the health professions outside your own. Third, we hope that out of the iCats experience, your ability to work collaboratively in a team environment will be enhanced. Fourth, we hope you will see examples and understand why collaborative team-based care is valued by patients. And finally, you will learn a particular model of communication that's been shown to be useful in team-based care, and you'll have the opportunity to practice it in a standardized patient setting. Thanks for your attention, and now let's hear from the experts.
So to me, iCats is a structured way for health professional students to learn with, from, and about each other. This is the foundation for learning about what each profession does and how you can work together as a healthcare team in the future.
For me, iCats represents an opportunity for our students to really address rehearsal for what they're going to be doing and expected to do when they get out of their respective programs, is to function in teams, communicate in teams to improve health, or to talk to people, to work with teams to help people through tough diagnosis. And so iCats is this opportunity that students wouldn't otherwise get if they wouldn't participate in something like this.
It's important because the complexity of care requires precision teamwork. And that's one of the reasons I think you're here today, is to understand why is it important for you now as learners. And it's important because this building block of teamwork is an essential skill, as important, if not more important, than anatomy and physiology or pharmacology, or developing a plan of care for and with a patient. As important is how you work and behave within the context of a team. So what better time to begin that journey than while you're learning your craft and understanding your discipline and understanding how your care intersects with care providers of the team members that you have around you.
Interprofessional education establishes the foundation in the mind of the dental student for the development of an holistic approach to their patients and prepares them for interprofessional practice set to provide well-coordinated, collaborative, high-quality, patient-centered care.
We do start this in the first year of the professional training programs for each of the healthcare colleges and programs that are involved. And it's important that they learn early that they're going to need to collaborate in the future. So it's important to learn how the training is handled at the various healthcare colleges, it's important to build respect early and to build trust early. So I think it's important that they start out collaborating so that it's not something new that gets introduced once they're in practice. If you learn to collaborate when you're a student, you'll probably be a better collaborator once you're a healthcare provider.
I like to see students who are joining our team aware that there are disciplines, and I like to see those students display some mindfulness about everybody's importance. I like to see them from the very beginning hitting the door, knowing that that exists, because that tells me that that's a student who knows what they're getting into.
It's critical to start interprofessional healthcare education early in a student's academic career because it allows them to begin building those bonds and relationships so that they learn to function in a team, become dependent on each other as a member of a team, and produce the best outcomes for the patients.
The sooner that you are able to open up a clear line of communication and use common language with your healthcare peers, the sooner you're going to be able to collaborate in patient care.
Already early on, you do interact with other professional teams, and it's a good way to start learning and be comfortable with interacting with the physicians and physical therapists and all the different professions, because you don't know when you're going to need it, but it is extremely important, I think.
Yeah. And I think that in the end, when we're working as professionals, and our main goal is to deliver the best care to the patients that we can, the best thing to have is good communication amongst the different professionals. Right now, we're moving toward a more integrated system. So I think it's great that we're starting this sort of communication between the colleges, between the professionals this early in our careers, and it'll be nothing but beneficial to us in the future.
Interdisciplinary team work is what we do. If there is a team in the hospital, it's the trauma team. It always has and always will be. It's the classic team environment where everybody has a clearly defined role. Everybody has to carry out that role really effectively in order for us to succeed. And success for us is a patient who does well and is alive. And everybody has to know what everybody else's role is, be prepared to interact with others, ask for help, offer help if needed, and then at the end, critically assess our performance as an entire team and ask ourselves whether we worked well as individuals and whether we worked well as a team. So for us, that team work and interdisciplinary work is what we do.
Probably the most important part of the team is the patient and the family. They're there to help us figure out what is the best way for them to be successful in their health care and figuring out how to get them back to doing all the things that they want to do.
From what I have learned from iCats, I will always keep in mind the fact that my decisions and my treatments and my plans of care, they are only one side to the puzzle. I always need to be cognizant of the fact that there are so many other disciplines that are involved in this patient's care that I may think I know what's best, and I may have my opinions about the particular treatments and our particular course of action, but at the same time I always have to be aware that there's so many other moving pieces involved in terms of the physician, the pharmacist, the nursing, everything. It not only has to cooperate with one another, but it has to build on one another. And if that's the case, the patient will ultimately benefit.
And when I learned how to give chemotherapy, it was a nurse practitioner in oncology and a pharmacist who really taught me how to give those drugs. They understood how to modify the dosages for kidney failure, liver failure, weight problems. And so I came to understand that pharmacist that worked with me, that nurse practitioner that worked with me, was much more of an expert than I was at that point in time. And we were a team. It kept me out of trouble, and it kept patients out of trouble. It was a good lesson to learn.
Doing some away rotations in Owensboro, my hometown, I was able to work at the hospital there and see they really, I think, do a good job of teamwork too. It was similar to this iCats experience in that we had a particularly difficult patient in the ICU that was needing some extra care and needing to go to a long-term care facility. And it was kind of neat to see how the physician played a role, and the psychiatrist physician, both, and the ICU physician, as well as the nursing staff, and then really the social worker too, which I thought was a good experience to see how everybody kind of worked together and had a different perspective. Just from talking to the patient, their different needs for the healthcare of that patient going forward, and everybody's able to kind of come together and really come up with a good solution pretty quickly. And it was a good balance of everyone's input, and it wasn't like it was all left on one person to figure out by themselves.
Teamwork is going to be the most critical part of healthcare into the future. As we begin to change our payment methods and we reward individuals for functioning as a team, that's going to be important, but even more important is for the patient. We need to make sure that we have the right team member there at the right time for that patient's individual needs. To do that, we have to know how to function as a team, to work together as a team for that patient, and make sure that the best care possible is delivered at the right time, at the right place, and by the right person.
It is clear that trends in healthcare delivery make it urgent that dental education embrace interprofessional education, so that the next generation of oral health providers will be prepared for a future where dentistry will be more closely linked with medicine.
So interprofessional education is the foundation for successful collaborative patient care. As healthcare moves towards bundled payments, that means that the most effective and efficient care team is going to be the one that can work in an integrated system with all professionals so as to optimize the payment and the success of the patient's outcome.
I think when you think about the healthcare system of the future, it's going to be all about teamwork. When we take care of complex patients, we take care of patients over the continuum from being in the community to coming to a university hospital. We need to have coordination. And so we need to have teamwork. We need people working at the highest levels of their capabilities. It's no longer going to be one doc, one patient. It's going to be a group of people taking care of a group of patients and doing the very best they can with them. And I think it's best if our trainees, our students, our residents understand that right from the beginning, and they start developing relationships and respect for each other right from their first day of medical school.
So one of the most beneficial parts of iCats is the patient simulations that we have. So far and away, these are highly rated by the students that are involved. So we bring in actors that come in and serve as standardized patients, and we'll do an activity where the students have to collaborate in real time and have to have an opportunity to pretend to take care of a patient. So it allows them to communicate with each other in front of a patient, and then allows them an opportunity once they're finished with that collaboration to then reflect and talk about what went well, what didn't go well, what they would do differently in the future. So it's a great way to practice when we bring those standardized patients into the mix.
Yeah, so iCats to me is just being able to, one, meet people outside your own college. We spend a lot of time just really even just with our own class within our own college. And so to be able to meet other people and just get to know more faces that you see walking around, and also really getting to know what other specialties do. I had no idea what a speech pathologist actually did. So now I kind of have a better understanding of what they do. I knew, mainly with like physical therapists, just being an athlete growing up, I knew kind of, how they helped with that, but to be able to help with these, patients that we saw, So just to be able to kind of learn about the other medical community that we are all part of.
Working with students from other healthcare professions, this was something I hadn't really intended to be a huge benefit, but it actually was. It really kind of emphasized the fact that we're all going through something similar. Med school, PT school, dental school, whatever it is, it's tough. And it's nice during iCats you're allowed to talk to these people and make relationships and make new friends and kind of vent about the frustrations and the benefits and the positives and the negatives of these really demanding health professional programs. So it was nice to have an opportunity to talk to people outside of your own program.
One particular topic that I remember students really engaged in was error disclosure, because errors do occur. And we talked about how we might avoid a medication error going forward. And so, of course, all of the students in my group were very thoughtful. It was an organic discussion, authentic, people sharing their thoughts and understanding and ideas. And they all agreed that they would absolutely need to come forward if they thought a mistake was being made, if they thought an error was going to occur. And then one student said, I know I should do it, but I just wonder if I would have the confidence to tell a big-time surgeon that he might not be giving the right medication. And there was a pause, and everybody was thinking about their own particular situation and how they would handle it. And one of our brave medical students said, well, if I'm that surgeon, I hope you would tell me, because we are all safety nets for one another. We are all one team, making sure that patients get the very best from each of us. So, I welcome you to the iCats curriculum. I look forward to working with you as you learn with, from, and about each other. And why does this matter? Because we are going to give high quality, excellent, team-based patient care.